Good afternoon. I am going to call to order this meeting of the Public Health, Environment, Civil Rights, and Engagement Committee for Monday, August 6th, 2018. My name is Philippe Cunningham, and I am the chair of this committee. With me at the dais are Council Members Schrader, Gordon, Johnson, and Council Vice President Jenkins. Please let the record reflect we have a quorum. Also want to say thank you to our clerk, Peggy, and our assistant city attorney, Andrea. So thank you for being here and for all your hard work. So today on our consent agenda, we have two items. The first is authorizing the submittal of an application to Bloomberg Philanthropies American Cities Climate Challenge. Selected cities will be accepted into a 2-year acceleration program to support meeting near-term carbon reduction goals. And the second is accepting a grant from the Minnesota Justice Foundation in the amount of $4,500 for participation in Minnesota Justice Foundation's Summer Law Clerk Program. Do committee members have any questions? All right, seeing none. I move approval of the consent agenda. All those in favor of the motion, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is approved. Our first discussion item, we have, we have two discussion items today. The first that we have is the City of Minneapolis City Academy for Youth presentation. Katie Wolminger, urban scholar in the Neighborhood and Community Relations Department, will be giving today's presentation. Come on up to the podium and say your name for the record, please.
Good afternoon. My name is Katie Wilmering, and I am an urban scholar working for the Neighborhood and Community Relations Department. Today, I will be giving a presentation on the City Academy for Youth to be received and filed. Before discussing the City Academy for Youth, I want to give everyone a brief overview of the City Academy. In 2012, the City Academy was created by Neighborhood and Community Relations for Minneapolis residents who were 18 years or older. Three main purposes for this academy were to educate residents and city government, develop future leadership, and allow staff to hear resident opinions. The City Academy is 5 sessions long, with 1 session being held each week. To engage residents in this academy that had presentations and tours from various departments, with topics ranging from how your house is assessed to 311. Along with that, participants got a tour of the water plant and fire services. Now, the City Academy is held each fall. Along with the City Academy, NCR is piloting a new program called the City Academy for Youth. City Academy for Youth has been created to address the gaps in participation from residents ages 18 to 24. Youth participation is little to none in the City Academy, and city boards and commissions, and neighborhood boards as well. This can be illustrated from the 2 graphs shown. The percentages represent the 2014 and 2016 demographic of the neighborhood boards and the appointed boards and commissions, while each graph has outlines to represent the demographic of the city of Minneapolis for a comparison. As you can see from the graph, there's an overrepresentation of people ages 25 and up compared to an underrepresentation of young adults ages 18 to 24. According to the graph, in 2016, about 14% of residents in Minneapolis were ages 18 to 24, while only 2% of this age pool were found on these boards. Therefore, by designing this academy specifically for youth, we hope that it serves as an entry point to those who want to get further involved with their government. Moving forward, for the City Academy will be held over 1 week, August 20th to the 24th. The cost of this program is free, as well as transportation. By providing bus tokens to participants, they will be able to take the public transportation to and from City Hall, and this is in hope to eliminate transportation as a barrier to attend the academy. Each session will last 2.5 hours long, starting at noon and ending at 2:30. The sessions will begin with a lunch, and then presentations will follow. However, I want to note these presentations will not be ordinary presentations where one person is speaking and the audience is listening. Before the academy begins, I will have met with every presenter to ensure their presentations are engaging and and have questions opening for youth to create it more like a conversation for them. Moving forward, I will briefly discuss the outline for the City Academy for Youth. As I stated before, there will be 5 sessions, each with their own topics. The first session will include general government, and presentations will have the City Attorney's Office, Finance, Minneapolis Parks and Recreation, and Public Works. The second session will include presentations from CPED, Civil Rights, and Step Up, and their topics will include affordable housing and employment opportunities for youth. The third session will entail 911 and police. A portion of this presentation will include an open forum for youth to have the ability to ask questions they typically wouldn't get answered. The fourth session will include the health department. They will be discussing mental health and drug abuse and ending with a bit of yoga and meditation. Finally, the last session will include a meet and greet with city leaders and staff. Currently, the mayor, Councilman Felipe, and Council President Bender have all been invited. Moving forward, I will give you a brief overview of the steps I took in designing and organizing the City Academy for Youth. To begin my process, I reviewed the City Academy. After reviewing the City Academy, I noticed there was 3 main items I needed to address and tailor to make it better for youth. First were some of the presentations. Although the presentations were great, learning about how your house is assessed and learning more about 311 is not exactly fit for youth. So instead, that's when I chose to replace with the health department. Second was retention. After reviewing the sign-in sheets, I saw that retention declined incredibly. It was clear that the participants could not fully commit to 5 sessions over 5 weeks. With that, I decided to create the City Academy for Youth over 1 week, and with the city officials, the meet and greet, hoping that'll incentivize participation. And then third was transportation. Since the City Academy for Youth was geared for ages 14 and up, I knew I needed to find a way for youth to have the ability to come, and that's where the bus tokens came in place. Following that, I was able to meet with various departments. I talked with them and discussed information that they thought would be valuable to teach youth. After discussing with those departments, I was able to create an outline for the City Academy for Youth. Once that outline was created, I was ready to receive feedback from youth. First, I presented at the Minneapolis Youth and Coordinating Board. There, I was able to gain valuable feedback from topics and departments they thought were going to be interested. Some topics they brought up were mental health, affordable housing, and what to look for when you're first trying to own or rent. After having their feedback, I was able to reconstruct the outline and create it to a survey. Then I was ready to begin my youth focus groups. Majority of the participants from these youth focus groups were Teen Teamworks, a program, an employment and education program for youth ages 14 and 18, sponsored by Minneapolis Parks and Recreation. These focus groups played a very crucial role in the development of the City Academy for Youth. By talking with youth, I was not only able just to see what they were interested in, but I was also able to hear and learn more of the questions that they were interested in. With that information, I was able to relay back to our presenters to help them really structure their presentation and understand the perspective of where these youth are coming from. Overall, by the end of my focus group, I was able to talk with 95 youth between the ages of 14 and 18. Along with that, I was able to obtain representation from the majority of communities in Minneapolis. Moving along, I will briefly discuss the youth survey I took. The survey given to youth entailed 6 departments and had about 20 different topics overall. From that, you will see the top 5 topics from the survey, and they were financials of Minneapolis Parks and Recreation, U.S. Bank and Target Center, Minneapolis's youth employment opportunities, youth violence prevention, and procedures and protocols for police. These results for the survey help me indicate which topics were the most important and interesting to youth. Along with that, I was happy to see a wide variety of representation from the departments. Another element that I was able to grasp from the survey was understanding the way youth communicate and learn about events. One major communication that they have is Snapchat, a social media platform that the city currently does not use. After speaking with the communication department, I was informed that Snapchat is just not reliable due to data retention issues. However, in order to still catch youth's attention with Snapchat, I was able to put a QR code at the bottom right-hand corner of the flyer. Therefore, youth can use their own Snapchat to learn more information about it. As of August 1st, the City Academy for Youth has been open for registration. Our communication began small by opening up to NCR staff and other programs such as One Minneapolis Fund and the Safety Strategy and Collaborative Safety Strategies, about 20 organizations. This was intended to allow youth who are underrepresented in other established programs to register. Then on Friday, the communication went through the normal channels the city uses, along with Teen Teamworks, Step Up, and the Minneapolis Youth Coordinating Board. Currently, there are 6 people registered for this program. In the next 2 weeks, I plan to leverage the connection to youth organizations the NCR staff has, and I am currently reaching out to the Minneapolis Public Schools to see if they could assist me in my outreach. Thank you, and this concludes my presentation. I will stand for questions.
All right, thank you so much. That was very detailed. I have a question or comment from Council Vice President Jenkins.
Thank you, Mr. Chair. And Ms. Wolmering?
Correct.
I just want to say, wow, what an incredible presentation and a seriously necessary, I think, project and program to get young people aware of city government and how it functions, but also awareness of opportunities to get involved and help to shape the direction of our city as well. So you are to be commended for your efforts. I'm just curious, you're an urban scholar?
Correct.
Are you in college or have you
Yes.
graduated?
I am a rising senior at College of St. Benedict and St. John's University.
Wow, wonderful. Great work this summer, and good luck with the academy.
Thank you.
And hopefully other council members will get an opportunity to attend
Yes, definitely.
the open house as well.
Mm-hmm. We
Okay.
can extend the invitation.
Please let us know when that is.
Definitely.
Thank you.
Great. Now we have Councilmember Gordon, followed by Councilmember Schrader.
Yeah, thank you very much for all your work and initiative on this and getting it going. I think this is significant. I really appreciated the problems you outlined at the beginning, how difficult it is for us to get youth on our boards and commissions. And I think that's a key age group that's often missing. I've thought actually it might be something for us to consider at some point is just holding a seat for people who are 24 and under on all our boards and commissions. That does create, people wonder about, should we be holding seats for other groups? And I know that I haven't got a whole lot of traction on that, but the more we keep getting our information about who's already on the boards, I think people will realize that. I believe there are actually a couple boards and commissions. The way they're set up, they do preserve seats for youth, and I think that's something to think about too. Maybe it's even more important on some boards than others. But what good will that do if we're preserving seats if nobody's even applying and wanting to go and understanding it? So this kind of thing is so fantastic because it will get them involved. And in fact, now at this point, I think I want to see how amazingly successful this academy is, because maybe we'll have so many people applying that we'll see us getting up to that 14% that you're obviously looking for. Now, if we want to help drive people to apply and register, should we just be pushing them to the city's website that's in the NCR department?
Correct. If they go there, and then they'll be able to see the website, and then the registration link is on there. It's a simple Google form.
Fantastic. You think if they just Googled City Academy for Youth Minneapolis, they'd take us right there? I might try that right now.
Okay. I'm not positive.
I'll
on
test
that.
it out.
Okay.
All right. Wonderful. Thank you so much.
Yeah, no problem.
Councilmember Schrader.
Thank you. I just wanted to echo what the other council members have said already. I especially found it helpful, your analysis, and also kind of the example of the problem solving, how you kind of address the issue of Snapchat. So great work. Thanks.
I want to echo how impressed I am with this presentation. Very professional, very well put together, very well thought out. So thank you for the time that you clearly put into not only thinking about all of the details of what this looks like and making sure that youth voice is centered in shaping the content, but then also the way that you translated that to us here, top notch. So great work. So I'm curious, what is the maximum amount of students that can register?
Currently, we're looking at 30 to 40.
30 to 40. And aside from sharing this particular link, is there anything else that we as council members can do to help get the word out and get young folks excited about participating?
In particular, not anything I can think of. I can send you guys the flyer to help get that word out, and
That'd be
it's
great.
currently being translated as well. So
Perfect.
once that is done, I can send that to you guys as well.
Great, thank you. I also just want to say to my colleagues as well as to city staff, as we are talking about being more inclusive of young folks, particularly 18 to 24, that we want to potentially save seats for them, but we want to make sure that we're not bringing youth voices in to tokenize or to be decoration. Like, look, we have now a higher level of representation, but yet young folks actually do not have influence or are empowered in that space. And so we have to make sure that we're thinking and really pushing our boards and commissions to actually be more youth inclusive and be able to see that young people bring a very valuable analysis to the table that we don't have currently. So thank you so much for helping us think through how to bridge that gap in terms of bringing folks in. And I hope that the more folks we bring in, the more the culture will shift. And so it's folks like you who help get that ball rolling. So thank you so much for your presentation. And seeing no further questions from my colleagues, I move to receive and file this presentation. All those in favor, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is approved. Thank you so much for that. Next, I think I may have said that there were 2 discussion items before, but there were actually 3. So our second discussion items is the Healthy Livings Initiative presentation. Patty Bowler, Director of Policy and Community Programs, and Laura Pratt, Healthy Living Manager, both in our health department here, will be giving the presentation. I want to add that this is a part of the presentation schedule that we have as a committee that is intentional about bringing forward all of the various things that are happening throughout the departments that report to this committee. We have the health department, we have sustainability, we have civil rights, as well as neighborhood and community relations. And so we want to make sure that folks, both my colleagues as well as the community, are well informed about all the various bodies of work that are happening and how passionate our city staff are that work here. So I will now be turning over to Ms. Bowler, if you will take it from here.
So Chair Cunningham and members of the committee, thank you for that wonderful introduction. Really appreciate it. Laura and I are going to talk about our Healthy Living Initiative. And before I get started on the PowerPoint, I wanted to draw your attention to this piece. Hopefully you have a copy of it. And this, I believe, will also go on our website as well for public consumption. And it's a really good overview of our healthy living work. So we're really excited to talk about the Healthy Living Initiative. And we work closely with many community partners to implement 34 projects at 640 sites across the city to eat healthy, be physically active, and to live tobacco-free. In order to understand the healthy living work, we need to look at the disparities in chronic disease in Minneapolis. So this graph here shows Minneapolis deaths from chronic disease per population group over a 5-year period. And it shows all chronic disease and also premature deaths before age 65 for the population groups. And as you can see, there are big differences between the white population and populations of color and the American Indian groups. We see 5 times as many American Indians dying prematurely from chronic disease, such as heart disease and diabetes, than white people. And our Healthy Living Initiative is designed to prevent chronic disease across the population, but we're mostly focused on groups that are most at risk.
Patty, if I can jump in really quick.
Sure.
Within this definition of chronic disease, is addiction included?
Well, within what we work on, not so much.
Okay.
Most likely chronic disease or addiction is included in the big umbrella of chronic disease, but I'm going to talk specifically about what we're focused on.
Not necessarily here is what I hear you say. Okay, thank you so much for that clarification.
Thank you, Councilmember Cunningham. The drivers of chronic disease are largely preventable health behaviors, including poor nutrition, physical activity, inactivity, tobacco use and exposure, as well as the underlying social conditions of health. And so to your point, we focus mainly on the chronic conditions on the slide. These behavioral drivers, however, are very much influenced by the social determinants of health that affect health overall. So you know these are poverty, housing, inequality in terms of healthcare access, low educational levels, et cetera. Our approach is mainly through changing policy, systems, and the broader environment, but we also focus on working through our partners with individuals to help them adopt and maintain healthier behaviors. We work in a variety of settings such as schools, work sites, healthcare clinics, and neighborhoods, and we have many, many partners, and it's really through partners that we get this work done. So we have contractual partners and also informal partnerships throughout the city, and we really need to rely on their expertise, their cultural know-how, their relationships to do the healthy living projects. We play a variety of roles at the health department. Sometimes we're funders, we're conveners, we're supporters, we're drivers of projects, and we work closely with other city departments such as Public Works and CPED to get the work done as well to achieve shared goals. But I wanted to say that because our work is focused on policy change, we really see the City Council as a key partner. So I wanted to let you know that this work is all grant funded, and it's really been that way since the beginning. We currently have about an investment of $1.5 million per year to do this work. We're really fortunate in that we've had State Health Improvement Partnership, or SHIP dollars, since 2009. And we've also received 3 federal grants since about 2012. We're just wrapping up a federal grant called the Community Community Wellness Grant, or CWG. That's going to end in December of this year, and that will represent like a 67% funding cut for us. So now I want to introduce Laura Pratt, who is going to really give a good flavor of what the work is all about.
So you actually, if I can really quick, you breezed past that funding cut. Could you state that again more clearly, what that was?
The grant, it's a federal grant. It will end in September of 2019, and that represents, or 2018, I'm sorry. And that represents a 67% cut to our overall budget. We knew about that. It's not, the grant is not being pulled early, it's just ending. And we're going to circle back to that a little bit later on in the presentation.
Okay, thank you for that clarification.
Good afternoon, Committee Chair Cunningham and council members. I am Laura Pratt, and I have had the honor of managing the Healthy Living Initiative for the last 12 years. So I'm going to tell you about our projects, and I would love to describe every single one of them outlined in this brochure, but it would take me too long. So I'm just going to focus on a handful that really illustrate some of our partnerships and approaches. So when possible, we try to layer our focus areas, physical activity, healthy eating, tobacco control, and quality healthcare in one place. And we do this because there is no magic bullet for chronic disease. We need to address all of its drivers to make a difference. So schools are a great example where we do this. We have a long-time funding partnership with Minneapolis Public Schools. Together, we have launched weekly bus stop and walk initiatives at 16 schools, reaching an average of 4,000 students every single week. We've trained teachers to implement a bike walk fun curriculum. We've purchased hydration stations at 4 schools to replace warm, weak water fountains and provide kids with cold, refreshing water. We've supported smarter lunchroom and farm-to-school efforts to improve healthy food options in the cafeteria. And just this last year, we piloted the use of community health workers in South High School's clinic to help individual students and their families address weight issues. And I share this example specifically because it shows what can happen through a long-term sustained partnership and the reach that we can achieve with a big institution like MPS. As you know, Minneapolis has taken bold steps to reduce tobacco use and related disparities. And in your short tenure, we have collectively restricted menthol to tobacco-only stores and liquor stores, and that went into effect last week. And then on October 1st, our Tobacco 21 will go into effect, which will make it illegal to sell tobacco to anyone under 21 in Minneapolis. And in addition to this policy work, the health department has been implementing a smoke-free housing campaign based on a 2016 survey that we did showing big and really unacceptable inequities in the availability of smoke-free rental properties that accept subsidies and in buildings that don't. So it's hard enough to get affordable housing in Minneapolis, and then the likelihood that you're going to be exposed to secondhand smoke in that housing is higher than is acceptable. So our goal with this campaign is to increase the availability of smoke-free housing in some key neighborhoods and among the top 25 biggest buildings in the city that are not smoke-free yet. I'm also going to talk about our public housing work. Since 2013, we have partnered with the Minneapolis Public Housing Authority and the Minneapolis High-Rise Representatives Council to improve opportunities for healthy eating, physical activity, and chronic disease self-management in 12 high-rise buildings, and this is affecting 1,700 residents. We have conducted walking audits to identify opportunities to improve pedestrian safety around the buildings and shepherded some recommendations through Public Works and some other city committees to make some changes. We've started over 10 community gardens, partnered with the Twin Cities Mobile Market to bring affordable groceries directly to residents. We're working on healthy vending in the buildings because surprisingly and sadly, vending machines are a key source of meals for many residents. And collectively, these activities have increased access to healthy amenities in the building. And while access is a necessary component to health, it is not sufficient, as some residents really struggle to prevent and manage hypertension and diabetes. And so to help the individuals, we have coordinated the on-site delivery of nutrition classes and chronic disease self-management classes by finding and capturing community organizations and clinics that provide those classes and then bringing them on-site to do so. And then very significantly, we have also integrated community health workers onto the social service staff in the public high-rise buildings. And these community health workers help residents manage their chronic diseases by helping them create personal goals, helping them achieve their goals, doing weekly blood pressure checks with them, helping them find or connect to their healthcare or other community agencies that can help them. And in addition to make that community health worker, those services financially sustainable, we have helped Volunteers of America set itself up to bill Medicaid for those services. And I share this example because it illustrates how our partnership with MPHA and the High-Rise Representative Council really leverage the best of what we each have to offer. The health department brings its public health expertise and connections to other city departments and other entities in the community, and they bring their strong, trusted relationships with residents and their insider knowledge of how to get things done. It also shows our value of community and resident engagement. Residents serve on an active living advisory committee that we co-convene with the High-Rise Representatives Council. And these residents are really guiding and deciding what is happening in their buildings and across the system. They also lead activities in their own buildings, such as walking clubs and the involvement in the community gardens. And they have become engaged in city processes. They've met with city council members to discuss dangerous pedestrian issues around their buildings. And one resident now serves on the pedestrian advisory committee. So the impact of this is really exciting and big because we're really addressing the issues that people have in terms of having a healthy place to live, but also some of the health issues that they face by themselves. And I'm just going to read a quote that sort of, I think, illustrates the example and the impact of this work. And it's in your flyer here. This is from a 77-year-old who lives in the Cedar Riverside community. He says, I see a lot of Americans riding bikes and they're happy. I took the risk of riding a bike in my old age and it was a big initiative for me. Now I'm feeling stronger and healthier. Before I would sit at home and get stressed when I was alone. Biking has helped connect me and reduce emotional difficulties. I'm also finding that riding is as important as taking medicine for some of the chronic conditions that I have. So before I turn it back over to Patty, I just want to recognize the amazing staff that makes all of this work happen, and many of them are here. And back to Patty.
Thank you, Laura. So I mentioned that one of our challenges is funding, and we have this federal funding that's going to be ending. We also are a little worried about our SHIP dollars, or our State Health Improvement Partnership dollars. Those are state funds and controlled by the legislature and the governor. They're based on the Healthcare Access Fund, and the Healthcare Access Fund is set to sunset in 2020 unless that sunset is repealed. And I know there are folks working at the Capitol to try to get it repealed, but no guarantees. And the state would have to find other funds in the neighborhood of about $35 million over the biennium to keep SHIP afloat. However, that's never, daunted us. We're used to funding irregularities. We did just, in terms of the opportunities column, we did just complete a REACH grant. It's a $4.5 million grant to the CDC over 5 years, and it's really focused on the African American and East African community in housing settings, and also the American Indian population working through organizations that serve them. So, stay tuned, knock on wood, cross fingers that grant comes through. We also think we have a good shot at a CDC prevention specialist. And we've had a number of prevention specialists come through our department. You've met many of them. They provide 2 years worth of really quality work, and the CDC pays their salary. And we think we have another one coming in September, October. And then lastly, this will, warm the cockles of Councilmember Gordon's heart. We think we're doing better in terms of chronic disease surveillance. Our research and evaluation division is making lots of progress in helping us get better measures around chronic disease. So we've always struggled with surveillance data because it's never really been representative of our population. And this is data like obesity rates, cardiovascular disease, et cetera. Our health department is starting to mine hospital and clinic data to better understand obesity rates, hypertension, diabetes, tobacco use. So this is electronic health record data, and we're really looking forward to seeing what this project is going to provide for us. I mean, not just for healthy living, but for other conditions that our health department works with. And I'm really hoping that our research and evaluation division provides a presentation at some point in the future. I'm looking at them now. In terms of council involvement, again, we've always really looked to the council to partner with us on this work. I know that, we know that Councilmember Gordon is going to be tweaking the staple foods ordinance, or has a proposal in place this fall, I believe. And the Wellness Committee of the city is going to bring forward a revised city healthy food and beverage policy for this group to consider, this committee. There's a lot of work that needs to be done at the statewide level. And we're really hoping that there'll be a proposal that goes through the legislature to raise the purchase age of tobacco to 21. And we already have some language in our legislative platform about that, our city's platform. And then there might be we've been working on sugary beverage reduction policies, and there might be some policies that come forward in the future as well. And then lastly, as Laura mentioned, we've got a voluntary effort to restrict or reduce smoking in rental housing. And we'd really hope that we could work with you on a ward by ward basis to really amplify that campaign. So I just wanted to close by saying that chronic disease is probably the largest killer of residents in Minneapolis or our populations. It oftentimes doesn't make the newspaper. However, we believe that decreasing chronic disease will take a sustained, comprehensive, and coordinated effort. And we really thank our community partners for their work, and we thank you for your support over the years. And with that, we will stand for questions.
Thank you so much. I have a comment from Councilmember Gordon, followed by Council Vice President Jenkins.
Thank you. I appreciate that. And I appreciate having my heart warmed by the idea that we'll get more data and surveillance coming in. I think you could see what kind of questions that I was going to be asking and curious about. And I think it's critical to track that.
I know.
In fact, one of my questions did have to do with the first slide, because we look at those disparities year over year over year. And I'm just wondering if we have any idea if we're making any progress at closing any of those disparities or not, or is that also something we're going to have to wait for when we get more of our data? And I understand that some of that data is going to look at what are the indicators that connect up to the chronic diseases, more so than just the gap. But I think just to feel like we're making some progress, or maybe to correct when we aren't making progress with some of our plans and what we're doing, because it would also be great to show some significant improvements, for example, as we work hard to push fresh produce and food into our city and make sure everybody has access to it. Are we reducing diabetes? Same thing with cancer and tobacco use. Is that something I should wait for?
Well, I have kind of two responses for that. So Councilmember or Chair Cunningham and Councilmember Gordon, the work that we've done, this is what Laura calls surround sound. We're kind of working on changing the environment so that it's more supportive for these healthy behaviors to occur. And I think we've made a lot of progress in changing the broader environment. But I really do think we're going to have to wait for the data that our research and evaluation department is going to be providing to really see those population health changes. But I'd invite Lara or anyone else to come up and talk about it.
Committee Chair Cunningham and Councilmember Gordon, I would add that we have snippet opportunities to look at some data. So for example, we have been supporting some Minneapolis clinics in improving some quality care initiatives around hypertension and diabetes. So we worked with North Point, for example, and with our funding and some support, they instituted a group visit model for hypertension. And so when they could look at those patients who participated in a group visit versus individual patients, they were able to see a fairly big difference in the percent of people whose hypertension was under control who attended the group visits versus their normal regular patients. We're also working on, we have just started, we're in our first year of a 5-year Merck Foundation grant to address diabetes outcomes or improve diabetes outcomes. And through that project, we'll have clinical data from patients from 2 clinics. So right now we only have sort of snippets here and there of actually outcome data, but as Patty mentioned, we will have more surveillance data really within the next 6 months.
Excellent. Well, I appreciate that. And I also wanted to comment a little bit on the Staple Foods Ordinance Amendment or tweaks that are coming up. We've actually got a couple pieces of research that are coming due. One is a survey that we did, the health department staff did, of the stores. And then we also, when we passed that ordinance with the University of Minnesota, agreed to do some studies too. So what I'm lining up to do is make some improvement based on the information that we get back. I haven't necessarily drafted what I expect to be coming. I'm expecting to do a subject introduction in August sometime, and then maybe in September of this fall, we'll be looking at the amendments. And I believe we'll probably be getting a report in first from both the health department's research and hopefully at the same time even, and the university's research, so we can kind of see that while we're crafting the improvements to the ordinance. Thank you.
Council Vice President Jenkins.
Thank you, Mr. Chair, and thank both of you, Laura and Patty, for this great presentation. I'm really interested in what the health department is doing around maternal health and helping moms and babies have healthy outcomes in our communities.
So, Chair Cunningham and Councilmember Jenkins, we make a pretty large investment in improving maternal and child health. However, the dollars only reach a smaller percentage of our population. We did just do a presentation, I think in June, with this committee on our maternal and child health work. So I think it's been a cornerstone of our department, but just in a nutshell, I think all of us could do better in terms of our outcomes. We've seen infant mortality fall. However, with certain groups, African American population, it stays steady. And we've got a special grant program called Healthy Start, where we're trying to work on infant mortality reduction. But I think I would just be delighted to come and visit with you at some point about what we're doing,
Okay.
if that works.
No, that would be wonderful.
Okay.
Thank you.
Great. I wanted to check our schedule, and I think that we had that presentation on June 4th. So if folks would like to refer back to that presentation. So I would like to jump in here as well. Thank you for all of the hard work that you do. I wanted some clarification around the CDC prevention specialist. What would that topic area be that person would be working on for the 2 years?
We applied for a CDC prevention specialist to continue our public housing work. Currently, Maria in the yellow shirt there, she has been working for the last 2 years along with Sarah Stewart with our partnership in the 12 public housing buildings. And so knowing that the federal funding that funds that work is ending in September, we really wanted to ensure that we would have some infrastructure left to keep some projects going. So that person would work very closely with Minneapolis High Rise Representatives Council and then the health department to coordinate some of the programs that we help bring into the buildings and maybe continue some of the other efforts like the vending initiative that's underway.
Great, thank you. I wanted to also, while this wasn't frequently brought up, it is in the description of the work. I want for us to be careful about how we talk about obesity. And I know that can be a little bit controversial because folks, but I just want to say I want to be careful about us treading into fat phobia or body shaming. And so I see here of us talking a lot about the contributing factors, and so not really necessarily focusing on that, but I just wanted us to be careful with our language and how we're framing health and what that could look like. So just wanted to name that as well. So are there any other questions or comments from my colleagues? All right, seeing none, I will move to receive and file this presentation. All those in favor signify by saying aye.
Aye.
Those opposed say no. The ayes have it, and that item is received and filed. Thank you so much to Patty and Laura. Our third and final discussion item is the environmental services presentation. Patrick Hanlon, Director of Environmental Programs for the Health Department, will be giving the presentation today. The floor is yours.
Chair Cunningham, council members. My name is Patrick Hanlon. I'm the Director of Environmental Programs. Thank you so much for allowing us to come up here today and talk about the environmental services work. It's a very operationally focused group. And so in being operational, we don't often get a chance to come before council and present some of that work. So I'm going to do my best to cover all of the areas. When you talk about pollution in a city like Minneapolis, it's a wide net of issues. So bear with me, and I'm just going to walk through some of the work of the Environmental Services Unit. So, and just to eliminate any confusion, there are two divisions with the term environmental in their title. One is environmental health, and the other is environmental programs. Environmental Programs oversees lead and healthy homes, and then the Environmental Services Unit. The work that we're going to talk about today is within the Environmental Services Unit. And before we go forward, I didn't get their names as much in this presentation, but could Zach, Sydney, Junwei, and Sarah stand up if you're here? These are seasonal techs, and Connor Kessler, sorry, I didn't include you, I'm sorry. If you could stand up, he's our urban scholar. Their capacity being here, there are seasonal technicians and brought to us with funding from the Mississippi Watershed Management Organization and Public Works Department, funding that you guys have authorized here. Their capacity, their ability to increase our capacity to do the work that we do during the summer is, we would not be able to get the work done that we get done without them. So a big thank you to them for the work that they do. The Environmental Services Unit protects public health and the environment from pollution through 3 areas. One is through permitting and regulatory response. One is through monitoring and screening. And the third is through initiatives and areas that display leadership in the environmental field. And I'm going to cover all 3 of these areas. So our base work and our cutting edge work is, the summary of it is we have around 8,000 inspections, 1,200 permits on a low year. I think we were more closer to around 2,000 in 2017, 5,300 pollution control registrations, bringing in $2,311,000 in 2018 revenue. And this is that funding is really a justification for the service that we provide here in Minneapolis that few cities can provide. So a lot of times people ask us, how do you do the work that you do in Minneapolis? And that funding allows us the justification to provide that service to residents. So one of the areas that doesn't get talked about a lot is our storage tanks. When we talk about permits and regulatory response, we had 121 tanks removed in 2017. There are likely hundreds of tanks still underground across the city undiscovered. This is part of our legacy pollution. So they can be full of fuel oil or other chemicals that remain underground. So we go in and do the third site overview of removing those tanks and then making sure that the soil around those tanks is remediated and that pollution is carried out and remediated. In the future, we'd like to see more field and record research and assistance in finding some of those old tanks ahead of
If
time.
I can jump in real quick, I
Oh,
apologize. Council Vice President Jenkins.
Thank you, Mr. Chair. So, Patrick, I'm just curious, or Mr. Hanlon, sorry.
That's okay.
So this is the legacy pollution. What are people doing now with gas and other chemicals? Like, how is that being introduced in our
Sure.
community now?
Sure. So Chair Cunningham, Councilmember Jenkins. So a lot of these tanks was the result of using fuel oil as the main source of heat in a lot of the buildings that we used, or in the fuel that we used to heat buildings. There are still, we also permit sites on above ground storage tanks in gas stations. And it's not to say that when I say legacy pollution, it's not to say that there isn't still pollution in areas of concern, like PERC in other cities besides Minneapolis, or in our auto body shops and some of the chemicals that are used. So there's still definitely concerns with pollution that's being, the way that we're using chemicals today and the pollution that can come from that. So one of the other future areas that we're looking at is a legacy cost share. The possibility of a legacy cost share is to helping folks overcome some of the financial barriers that allow them to take care of some of these issues. So another legacy pollution area is we had 172 well permits in 2017. We have 2 delegated well programs through the Minnesota Department of Health. One is our construction well program. So anytime there's construction going on in Minneapolis and examining, doing environmental review. And then we have 25 transient non-community well supply program wells. And those are the wells that you see out at your parks with the handles on them where people are going out and getting well water at our parks. In the future, we'd like to, again, identify old wells that don't have record of sealing. And that picture in the lower right is just from this past week of a well at our park boards where we're trying to find out what happened with a well and making sure that it was sealed. Because in the upper right-hand corner, there's that big channel down through that well. Those can be conduits from pollution into our underground water table. And so we want to make sure those are sealed properly. Again, in permits and regulatory response, erosion control, we have a federal EPA requirement, the National Pollution Discharge Elimination system. It's protecting local rivers, lakes, and streams from erosion. We have between 300 and 400 active construction sites going on in Minneapolis, and if we are not taking care of the sediment coming from those sites, it can wreak havoc on our local waterways. And that can ruin aquatic habitats. It carries pollution to our local waterways, and it can also increase the risk of waterborne disease outbreak. And so we want to make sure that sediment is not getting into our waterways. And those pictures below are examples of erosion control and construction sites. And that one on the lower right is kind of last case scenario that you want is protecting the actual inlet itself. And those are some of the pictures from our inspectors that have been out this summer. In the future, we're looking at an ordinance revision in 2019 and conducting an internal audit to make sure that we're running our practices internally, following EPA standards and Minnesota Pollution Control Agency standards. With permits and regulatory response, noise, we spent a lot of time on noise issues, and the inspectors see that view on the right-hand side of the data logger, the noise monitor, a lot during the summer and year-round, really. We permit amplified sound permits from block events to the Basilica Block Party, 889 after-hours construction permits in 2017, and we try to balance that between being able to finish a project. It may require people coming in so that they're not blocking traffic during the night, and then also residents' right to peace and quiet in their neighborhoods. So we try to balance those when we're issuing those after-hours construction. And I should mention up above, I also linked in this presentation to the different areas if people want to link to get more information on some of these things. We had 716 complaints in 2017, and that was a lot of late night monitoring. So there's a lot of late night work that's done by the inspectors and going out and doing noise monitoring on these sites. In the future, we'd like to examine more proactive approaches and solutions in working on noise issues and how we can not be just responding to issues, but getting ahead of some of these issues. So we work with our business licensing group in working through noise management plans with new businesses that come in and other ways that we can get ahead of some of these issues. Permits and regulatory response, I just want to give this as examples. These are things that our inspectors saw during just this summer. On the upper left-hand corner is 55-gallon drums that were illegally dumped on a property. On the upper hand right is cooking oil that wasn't well maintained. Lower left-hand corner is saw cutting going straight into one of our storm drains. And the inspector took a picture to get the violation and then also got floor dry out there immediately to block that drain. And then the lower right-hand corner is just a unkept, poorly maintained HVAC unit. In our permitting and regulatory response, our energy benchmarking program, there was just a presentation on this, so I'm not going to go into a lot of detail on it, but it's an energy rating system for buildings over 50,000 square feet. Half of the greenhouse gas emissions in the commercial sector is within this group of buildings. It's making sure that energy use is a greater part of decision making as part of the market decisions that are being made out there, and how can we better do that. So we work in collaboration with the sustainability division and working on how we can do that better. In 2017, we had an 87% compliance rate. That's one of the highest compliance rates of folks that are running these programs across the country, and that's a lot of thanks to Nadia Khan for running that program. We focus on outreach, workshops, technical assistance, and reporting, including a scorecard so that business owners can see how they compare not only nationally, but how they can compare with their peers here in Minneapolis. And then we're currently conducting one-on-one outreach visits with building owners who haven't submitted their data right now and making sure that everyone has submitted the data who needs to. Trying to find ways that our green business program can be used to drive change. Those incentives can be used to drive change. And in the future, we're working on more workshops and direct outreach to drive change. This is the last part of our permits and regulatory response, not typically the most entertaining part of conversations that I have with folks. But I just want to pay special note to the number of inspections that have been done over the last decade and the amount of the output that the inspectors are doing, the number of inspections that they have. And I want to pay special note to 2012 and 2013 in the increases that happened there, because that's the next part of this story is that's when we started our 20% staff-driven model. Staff are allowed to spend up to 20% of their time on issues once they've completed their base work that meet our health department mission, our mission focused. And staff work on projects. They're trained professionals. They're closest to the work, and it's been amazing the amount of work that's come out of this philosophy. And that bottleneck right there is me. Traditionally would be someone in my position, and so trying to eliminate that bottleneck that happens with productivity. And so the next part of this presentation is the work that's done that's come out of that approach. So environmental monitoring, our environmental monitoring is health-based. It's not regulatory-based. It's a health-based approach to air quality, water quality, and soil testing. We look at what is the potential human impact and being as protective of that as we can be at a local level. One example of that is our air quality study that was done for volatile organic compounds. We looked at 64 different chemicals at 100 different locations around the city. In that study, we found unexpected amounts of TCE, and PCE, which are degreasers. PCE is tetrachloroethylene, which is PERC, used in the dry cleaning process. TCE is another industrial degreaser that's being used, and that's the next phase of some of the work that we're doing, is how do we get that out of our air here in Minneapolis. In the future, we are working with the Minnesota Pollution Control Agency on more neighborhood level studies for more pollutants. And then we are working on individual case sector work where we can also impact change. So we're also doing a lot of work right now around nail salons. In environmental monitoring, we're also looking at fine particulates. This is one of the most unhealthy pollutants out there to breathe in. We're restarting a program that we had in 2016. We're using new monitors and a new approach. And this is an example. The right-hand corner is an example of it. It's using an air beam. It automatically data logs the information, and so we're going to be looking at getting together volunteers, badges, and laying out that study this fall. Environmental monitoring, we also do testing at our garden sites. So at the CPED lots, the community gardens, there's over 100 garden sites that we've tested for pollutants. Most of them are clean. We did find 8 sites that we had concern. Again, we used a health standard, so we had a concern, and we recommended that they use raised beds on those sites and bringing in fresh compost and fresh dirt. In the future, we're also doing work with the University of Minnesota around carbon storage in our soils. Carbon storage in soils is an internationally recognized way to address climate change. It's one of the strategies for addressing climate change. So we're evaluating how we can use our soils as carbon sinks as a climate change strategy. I mentioned our well program. We also went above and beyond. We're only required to test for coliform and nitrates in our wells, our local wells. We decided to do a full gamut of EPA drinking water standards on those wells. Again, 99% of those tests came back with non-detect, so the water that's out there is mostly clean and healthy and good for you. We did find lead and arsenic and 1,2-DCE, which is a pollutant of VOC in a couple of the wells, a few of the wells, and we immediately removed those handles from those wells, and we've been working with the park board to remediate that situation. A good rule of thumb is if there's a handle on it, we've tested it, and it's okay to drink. You know, we use the litmus test if I would drink it, if our staff would drink it, or have their family drink it, then we keep that handle on there. This might be a presentation that might be good to bring back to the council and talk about it in a little bit more depth. We are trying to go out and present this work with the Minnesota Department of Health and raise awareness about the possibility of lead in other public water supplies. And we are assisting the park board with efforts to seal some of their wells. The third part of the work that we do here in environmental services is the initiatives work. The Green Business Cost Share Program, the Conservation of Minneapolis Bees, our biochar program, tree planting program, residential, commercial, and also looking at ways to identify emerald ash borer as it comes through Minneapolis, and then our STEM and pathways work. So the Green Business Cost Share Program is built on the philosophy of a public-private partnership. We've worked with over 150 businesses. We, of course, are the first city to have reduced PERC from the dry cleaning process. We're the first PERC-free city in the United States. We've reduced over 70,000 pounds in criteria pollutants annually. That's equal to about 1,500 cars off the road in terms of pollution. And we've removed 20 million pounds of greenhouse gas emissions equivalent. And that's equivalent to about 2,000 cars off the road in greenhouse gas emissions. We've also utilized the green zones and environmental justice areas as a lens for investment. And so we match 20% citywide, we match 30% in green zones. We match $20,000 citywide for energy efficiency projects, we match $30,000 in green zones. 2018, it was the first in the Green Cost Share program, was the first year for using multifamily in energy efficiency, looking at ways that we can address affordability. We're also supporting the 4D program and having increased incentives for folks that participate in that. So it's a way of addressing affordability through energy efficiency, and then also addressing affordability through getting more folks to sign on to longer term agreements to affordability in their multifamily units. This is the first year of doing 1 to 4 family homes and energy efficiency with the Lead and Healthy Homes program. In past grants, we've had 167 identified cold hazards. None of those projects went through with weatherization work. The folks that we work with in that program are 74% are low income qualified, and usually people do not have the money to put into weatherization projects. So luckily through the franchise fee, the Clean Energy Partnership, we've been able to provide more assistance both for the multifamily and for doing some of this weatherization work in our Lead and Healthy Homes work program. We've done the Green Business Refrigeration Program. We've rolled that out this year through the Clean Energy Partnership. And then we also have solar incentives, and we've seen a huge uptake in solar incentives, not only citywide, but very focused in the green zones. As developers have, as soon as we rolled out that program, we're calling up and asking, how do we get our programs in the green zones? Is this, you know, asking if their project was in the green zone and if it qualified. So that was an uplifting thing to see the concept of the boundary of the green zones, people taking that up and implementing projects based on it. In the future, I mentioned the nail salon work. We're also looking at auto body shops, perhaps being the first city to be an all waterborne paint water shops, auto body shops. The Green Cost Share program can be used as a tool for other incentive programs like electric vehicles, looking at residential solar adoption, low-income solar, and then scaling up the Green Cost Share program, the Solar Cost Share program. And in 2018, like I said, we had large success, huge success with our solar program. Those are the kilowatt hour, that's the kilowatt hour capacity installed across the city. So in 2016, 2017, and I don't even need to go into the numbers to show you what a huge increase that was just based on having additional incentives. Again, through the Clean Energy Partnership, the franchise fee made that all possible. And here's some of the sites that have gone up. We're just starting to inspect on these solar sites. Don't know why this one has animation, but we're going to go through it. Okay. So another one of our initiative programs is the conservation of Minneapolis bees. It was created in response to the 2015 pollinator resolution brought forward by Councilmember Gordon and Councilmember Palmisano. It's looking at internal source for pollinator and pollinator-friendly practice information for our internal departments. But then we also secured a $80,000 Fish and Wildlife Conservation Community Grant. We were able to reach out to 95,000 people, planted over 8,000 pollinator plants, handed out 10,000 seedles, these little seed balls that are can be planted in different areas across the city, and have planted 305 additional trees through that program. Another initiative that we have is the biochar program. It's a soil amendment that increases soil productivity by about 15%, depending on what's planted. It binds harmful pollutants, increases plant resiliency. It's one of the side byproducts of it is that it sequesters carbon for 2,000 years. It's internationally recognized as a climate change strategy. And we've done 12 demonstration sites here in Minneapolis. We've planted over 400 trees with it. We've done 200 pollinator patches using biochar. We're planting 2 fire station projects right now. We've used it in our lead safe home project and looking at ways to talk about increasing child nutrition and using that as a way to a preventative measure with lead poisoning. And then we're working with Public Works on composting giveaway mixes and scaling up on larger projects with other partners so that we can again, turn our city's soils into carbon sinks as we move forward in reducing emissions.
I have a question from Councilmember Gordon.
Just made me curious. Thank you, Mr. Chair. What are we planting at the fire stations? Is this going to be some food or trees or
It's a landscaping projects.
just grass, rain gardens?
Yes, yeah.
Okay.
Yeah, landscaping. There's also pollinator plants that we recommended for that project as well. Yeah, but natural landscape.
All right.
Yeah. One of the other initiatives, I have 2 more to go here. City Trees Program. We've planted 5,000 trees, give out 5,000 trees to residential customers for pickup. 300 trees planted on commercial properties annually, and working with the Minneapolis Park Board on ash tree identification. Emerald ash borer is coming through Minneapolis, and we are going to lose 250,000 trees to emerald ash borer. And there are a lot of implications with air quality, water quality. And so doing what we can to get ahead of that as it comes through and to identify and replant new trees. This is some of the work that some of the seasonal techs have been doing as well, is going out, working with the park board and doing areas where we can go out and identify emerald ash borer, trees that have been infected by emerald ash borer. And there's also going to be huge implications for people's ability to have those trees removed when emerald ash borer comes through. It's a quick process. And so to help folks to come up with programs and ways that we can help people remove those trees from their property as well. The last initiative that I'm going to go over is the STEM and Pathways program. This is a generational approach to our environmental work, is working with young folks in talking about environmental work here in Minneapolis. Science, technology, engineering, and math, STEM, are the jobs of the future, are the recognized jobs of the future. Minneapolis schools are woefully behind in math and science, and our schools are losing funding. At the same time, we have some of the most amazing science-related work and science professionals in Minneapolis, as I hope that I've covered a little bit here, and with some of the work that we do in our other departments. And so through our Minneapolis Environmental Education Program, we're looking to connect kids through the Guys and Gems program with the Minneapolis Public Schools. And this year, we were able to start a pilot program, STEM Pathways program. We established 3 camps with our Minneapolis Public Schools Guys and Gems program, worked with 150 kids. We created, Marquita Keys, I should say, created a solar camp. It's the same camp that's offered at a local private school. And we've done soil science camp, looking at lead testing, tree identification camp, talking about some of those emerald ash borer issues with kids, did a visit to the water treatment plant, and the North Mississippi Regional Park, connecting kids to nature. And so, in the future, looking at this program, I think there's a tremendous capacity to build up the relationships that we're building with the Minneapolis Public Schools, and they're excited about it too. The director of their Guys and Gems program, I can easily say that publicly, that they're excited about connecting with us on some of the work that we're doing, connecting with the work that we're doing here at the city, connecting with the business partners that we're working with out in the community, and connecting it to the kids, and so that they can see science happening in their community, and they can see all these projects happening in their community. So, in the future, this is not a budget ask, we're looking at a position to coordinate a STEM Pathways work through the environmental programs, again, across the city of Minneapolis, with business and community partners to coordinate that work. And we can serve a much larger population of students, and we can do it in our environmental justice areas in North Minneapolis and South Minneapolis. And none of this work, I tell staff this all the time, alone, we can't do very much. And together, when we work with good partnerships, when we work with folks across the city, and these are just some of the partners, I couldn't get them all on here, but none of this work would be possible without the partnerships that we build and the relationships that we build to leverage and scale the work that we do here in Minneapolis. And none of this would be possible without the support of the council and the support that you give us and allow us to do the work that we do every day. So thank you very much and I may have gone over time, and I apologize. Thank you for allowing us to stand up here and talk about some of the work that we do, and just very grateful to be serving you and the city of Minneapolis in this role.
Great. Thank you so much for that. Councilmember Gordon?
I already had my question answered, but I really appreciate all the work that you're doing and the report. It's great to get this overview, and it seems like there's some fantastic initiatives. I am impressed with how that 20% initiative project is going and how it's turning out, and I think that's it's been a real kind of eye-opener or something maybe to think about. How can we help rely on kind of the self-motivation and passions of each of us? I know that a lot of people decide they want to work for the city because they really care about what their work is and what they're doing. And sometimes if we just open the doorway a little bit, you can get a lot more accomplished. So I appreciate that, and I appreciate you sharing how it's been going.
So I wanted to go back, thank you. I wanted to go back and ask about the ordinance update. You had mentioned in 2019 needing to revise an ordinance. And so I wanted to get some clarification on what's needed. It was like it was at the beginning, sorry.
That's okay.
There we
yeah,
go.
so that's with our erosion control ordinance. So we'll have to do some collaboration with co-construction services and with Public Works. They're also realigning some of their work right now, and so we want to get in conversation with them and see how we can align some of the work there. As you know, staff have pointed out, we recognize there's some needed updates to the erosion control portion of the ordinance, and so yeah, we'll be starting conversations about that this fall and hopefully have something in 2019. And so if there's anyone interested in helping out with that.
Great, thank you. And I think you said that Nadia is responsible for the 87% compliance rate. Is that correct?
Yeah, it's a whole team, but yeah, she works.
Well, I want to give a shout out. Well done. Because that's really high compliance rate. There you go. Good job. I mean, that's a really high compliance rate. Thank you to everybody on the team. Wanted to make sure we gave you a shout out. And so can you clarify, just to make sure that nobody missed it, can you clarify which of the initiatives that you discussed were staff initiated and driven?
I mean, I think all of that.
Yeah, I think so too.
Not only the initiatives, but some of our monitoring work too. I mean, I'm overwhelmed sometimes with the ideas that come forward with this staff, and they're very mission focused. And what can they do to protect public health? And so, anything from 2 on in this presentation was all driven by staff, and I'm trying to react to it and get them the resources to be able to make those things possible.
Great. I really appreciate your leadership style because there's so much space for, I mentioned earlier, city staff having so much passion, I think is underappreciated sometimes. And so I really appreciate your leadership style to give space for folks who know the work and are really good at the work and passionate about it to really be able to say, what about this or what about that, and be heard. I'm interested, how do we scale the biochar work more?
That's a great question. We are wrestling with that right now. We were out at the Metawakan Sioux community last week and talking with the folks who run the compost facility out there. They've had a change in leadership there, and so there was some interest in talking about ways to scale up with them. We're looking at, are there ways to do small-scale biochar production? And so we're also looking at that at the same time and what that might cost and what kind of partnerships we could develop to have local biochar production and use some of the waste. As some of these trees come down with emerald ash borer, how do we use some of that waste to produce biochar and increase our ability for urban farming and urban gardening?
And I'm not sure if this was covered, but can you explain what biochar is?
Yes, I'll try to do the short version. So biochar is a biomass, usually a wood product. It's heated up to 700 degrees Celsius, and when you do that, it creates thousands of little microfissures in the material, and that provides a beneficial habitat for microorganisms. It provides a way to store moisture, store water for the plants to uptake at all different times to be resilient, and then also for storing nutrients. So that's why we have the partnership with the Metawakan and Sioux community. As we take the biochar to the Metawakan and Sioux community, they have it sit with the compost, and that loads up that biochar with nutrients. And so then we bring it out to the sites that nutrient doesn't leach into the soil. It's readily available for the plants, and that's one of the ways that it helps the plants grow. So it's not magic. In fact, it's a technology that's been used in some ways by a lot of indigenous groups around the world for centuries, and it's just doing that in maybe a more little more methodology to the way that it's done.
Great, thank you so much. Seeing no further questions from my colleagues, I just want to say thank you again for your time, your energy, your passion. Thank you to the health department. And so I move to receive and file this presentation. All those in favor, please signify by saying aye. Aye. Those opposed say no. The ayes have it, and that item is received and filed. Thank you so much. I want to take a quick moment again to remind all of the riveted viewers to get involved. So call your council member, find out what you're passionate about, make sure that your voice is heard, and seeing no further business before this committee, we are adjourned.